Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today I'm at Morton Comprehensive Health Services, and we're going to talk about the Take Control Initiative, and joining me is Kimberly Butler with the Tulsa Health Department, the project manager. Welcome to the program.
Thank you. I'm glad to be here.
Now tell our viewers about the Take Control Initiative. Exactly what is it?
The Take Control Initiative is an initiative that is there to empower women with the choice of when to bear children. And what that means, if someone is younger and they're hoping to finish their education or get that first job or put some money in the bank first before they have children, just be at a point where they're ready, then this initiative will allow them to be able to choose when to have a child and postpone having a child until they're ready. Or if they're wanting to space having children, then it will help them to be able to space their children so that they can have healthier birth outcomes and have healthier health for both the mother and the child by using proper birth spacing. Or if they're finished having children, for example, then this initiative will allow them to be able to be pretty sure that they won't have any more children, but have the option to go back and have more children if they choose. And that's through long-acting reversible contraception, through education, outreach, and free clinical services. Okay, and I'll tell our viewers now we will have Dr. Humphreys, who's going to join us in the next couple of segments to actually talk about these methodologies and the pros and cons and what they do. Let me ask you this question in terms of the initiative. How did it get started? I mean, why is there such a need? In conjunction with the Tulsa Health Department, it's the George Kaiser Family Foundation. I mean, why did this even come about? That's a great question. So, looking at health statistics in Tulsa and Oklahoma and the United States, Oklahoma ranks 6th in the nation for teenage pregnancy. Also, 50% of all pregnancies in the United States are unintended. Yes, and 50% around that of unintended pregnancies occur while using some form of birth control. Usually it's using it incorrectly or inconsistently. And so looking at all these different statistics and looking at the fact that women who plan their pregnancies usually are much more likely to be healthier, to have healthier children, to finish their education, to have better jobs. Basically looking at all those things, that the choice of being able to choose and plan a pregnancy and plan when you're having children and how that really helps you, basically showed us that this is an area where we can really help improve the lives of Tulsans and improve health outcomes. Okay, now when we think about that, because some viewers may say, well, you're talking about women and taking control basically of their reproductive health and childbearing and that type of thing. Is there an age range that this particular initiative is targeted at? Are we talking about teens, which some people would of course have concerns about? Are we talking about people when they get more in their 20s and looking at marriage issues? I mean, exactly how does the initiative approach those things and access? Yes. So basically, there's some different questions there. So first of all, this initiative is for reproductive age females and that are at risk for becoming pregnant. And so yes, that would include some teens. However, with education, we're hoping to educate teens about all the different options about abstinence and as well as their different options, so that they're aware of abstinence is the best option. Postponing sexual relations until a later age is a good idea. However, there are some teenagers, we do have a high teen pregnancy rate, that are still having sexual intercourse and are at risk for becoming pregnant. And just the devastating effects that can have on someone's life in terms of not being able to finish their high school education. And it can just really have such devastating effects on your life financially and what you can achieve. It just makes life a lot harder. And so this will be available. However, we do hope parents are involved when possible in that decision, or someone that a teenager could look to when necessary. Okay, and that's what I was going to ask you in terms of parental involvement and including them in this initiative if their daughter is wanting to participate as a teen. So that is highly possible and encouraged. It is encouraged to have a parent or guardian, someone the child respects, involved in that decision making
Okay.
when it is possible.
Okay.
Yes.
Now let me ask you in terms of the initiative, how do people access it? I mean, I did mention that it's the Tulsa Health Department and George Kaiser Family Foundation that are partnering to offer this. So how do people access this kind of initiative if they have some interest? We will put up contact information at the end of the show, but do they have to come to the health department to sign up? I mean, exactly what do they do?
Okay, well, we have a website, and that's www.takecontrolinitiative.org, and they can go there for more information to find out more about the initiative, the different services offered, as well as if they were wanting to actually call to make an appointment, they would call Plan Line, and that number will be up at the end of the program, and that number will have all the different clinics participating. We have about 14 clinics participating, including the Tulsa Health Department, Morton, OSU Women's, OU Women's, Community Health Connections, quite a few
Just a
different variety
Okay.
of different clinics that are participating, Planned Parenthood, in the program. And so yes, they can go to any of those clinics, but we would hope that they would call the number, and then they would be connected to someone who can help them figure out which clinic is closest to them, or when the nearest soonest appointment is, so that they can go for
Okay, one quick question here before I
Yes.
need to take a break. In terms of cost, we're talking about an initiative, and Dr. Humphreys will talk to us about the different devices that are available and sort of the pros and cons. So if a person has no insurance or is struggling with cost, is there some assistance through this initiative to help with that?
Yes. So this initiative covers women for Mirena, Paragard, and Implanon. It covers the device. It covers insertion and removal fee, as well as STD and pregnancy testing when they live in Tulsa County and they're at or below 185% of the federal poverty level. So, you know, the money is available for those services so that they can be free. And if they're not in Tulsa County, OSU clinic with Dr. Johnson has some tobacco tax money that he can use to help with these services.
So others in the state could be able to access it as well by contacting this number and getting more information.
Correct.
Thank you so much for joining me,
Thank
Kimberly.
you. I appreciate it.
Please stay with us. We'll be right back.